This is episode 461 of the Rio Grande Foundation's Tipping Point, New Mexico. I'm Paul Gessing, president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. I am very pleased to be joined this week by Sandra Whisler. She is past president of the New Mexico Medical Society. Sandra Whisler, MD, I should say. And we can get into what kind of medicine you practice. And I'm also joined by Howard Gogel, MD. He is with Southwest Gastroenterology Associates, which is local here. So we want to get into issues in New Mexico with regard to medical providers, people being able to get doctor's appointments when they have them, whether that is here in Bernalillo County, in Santa Fe, in Farmington, JAL, or anywhere in between, and some of the public policy issues that need to be addressed to deal with this situation and improve it, or that could worsen it in the not too distant future. So thank you both for coming onto the show. And by way of introduction, I did a very inadequate job, but both of you, starting with Dr. Whisler, why don't you talk briefly about yourself and how this whole issue came into your purview?
So, I have a private practice where I see children with chronic conditions, special needs, developmental disabilities. I was trained here in New Mexico at the UNM School of Medicine. I'm actually a retired professor emeritus from that institution. I also have worked in Denver at Children's Hospital, Colorado, working with special needs children as well. And the reason I'm involved in a lot of this is I am a past president of the New Mexico Medical Society, and I really enjoy advocacy and legislative issues and trying to improve care for New Mexicans for their health.
Wonderful. And Dr. Gogel?
Well, I'm a partner in Southwest Gastroenterology Associates, and we are a private practice specialty group in Albuquerque, but we serve a lot of the state, and our interest in medical care in New Mexico is rather general. We see a lot of patients. We are currently faced with inadequate access to care in a lot of different spheres reflected in our work, and so we are very interested in the problems associated with that, and we are very interested in looking at potential solutions.
All right. Well, that's very good, and thank you for that, and thank you again for coming on. Now, when it comes to medical providers in New Mexico, describe, and Sandy, you're more, as I see it, the policy-oriented person here. Dr. Gogol, you run your practice, and so you have more in-the-weeds specifics about that. So for some of these early questions, I'm going to go with Sandy here. Lay it out for us. What do we face in terms of the medical provider shortage? Is it across the state? Is it just rural areas? And talk about a couple of the things that are potentially causing the shortage of doctors as you see it.
Well, New Mexico currently for 2021 is short 334 primary care providers. So that is part of the issue with trying to get appointments. We just don't have enough primary care providers to get in to see them in a timely fashion. We're short as well 5,863 nurses, believe it or not, and that's a huge problem, especially in the hospitals. Some of the reasons we're facing a shortage, we're trying to recruit providers to come and work in New Mexico, but if you're a young provider with a family, you're also looking at crime, you're looking at education and other issues, malpractice. How comfortable is the climate of malpractice, where you want to go? And we're having issues with all of those things presently. There are many counties in New Mexico that are in the report that the New Mexico Workforce Committee did that are red. That means they have they're below the national average by at least 10 providers. Some counties don't have any OBGYNs or psychiatrists. So it's a really big problem in rural New Mexico. Bernalillo County and the greater Albuquerque metropolitan area, we're still having some issues, but it's not quite as bad as it is out in the rural communities.
Now, this is not a new thing. We've had
No.
challenges in New Mexico for a long time, and getting doctors and nurses to come here. But it does seem like a situation that is worsening and potentially on the verge of really getting bad if the medical malpractice legislation passed in 2021 is fully implemented. So, briefly touch on the history, and then, if you would, the issue with that medical malpractice legislation.
Okay. When I was president of the New Mexico Medical Society, and
Sorry, I keep on calling it yes, society, not the association. I apologize.
that's okay. When I was president of the New Mexico Medical Society in 2018, the hospitals found a loophole where they could come in under the Medical Malpractice Act. Before that time, it was just physicians under the act. And so when we would get sued, for instance, our cap was 600,000. And then the trial lawyers could go ahead and, there would be court cases against the hospital, and they did not have a cap. Once they came in under the Malpractice Act, it was a one occurrence $600,000 cap. So there was no additional revenue from the hospital side if the physician was affiliated with a hospital. So in 2021, House Bill 75 was passed, which will eliminate the hospitals from the Malpractice Act by 2026 or so. But starting in 2023, our cap, which went up last year to $750,000, will go up to $4 to $6 million for providers like Dr. Gogel, and he can tell you more details about that. For me as a private practitioner, the raise last year for me was 12.2% in my malpractice premiums. That cost me $1,000 a quarter for a small practice that is, barely making it. It was significant.
So this legislation, when is that law supposed to take effect?
2023.
In January?
I believe so.
Okay. Yeah, it was delayed. Normally, laws often take effect the following July 1st. But it was delayed, so I don't know. Dr. Gogel, you've got a practice here. If you maybe would talk about the size and scope of what you do, where your patients are from, but also how this issue might impact you in your business.
The medical malpractice problem actually is an important factor for private practice physicians in the state. And the House Bill 75 process actually has a number of significant features which are problematic. One of the features is that a lot of outpatient surgery centers are now going to be classified as hospitals, and that makes it so that they are very difficult to insure, and it's not entirely clear that insurance is going to be possible within the current legal structure. And so there may be some very dramatic changes, and those changes will occur on January 1st of 2024 unless the legislature changes the HB 75, which was enacted in January of 2021, and then revised temporarily in December of 2021. And so there's actually only one opportunity to address the difficulties that have been created by HB 75, and that opportunity is going to be in the legislative session in early 2023. So that's why the 2023 year is very important. It is interesting, malpractice premiums are a fair bit higher in this state than they are in many adjoining states and in states in other regions in the United States. It is very difficult to get data on malpractice premiums, and the reason for that is that the malpractice insurance market is a private market, and premium costs are actually proprietary information, and so it is very difficult to be sure about the costs. Dr. Whisler pointed out what her costs are. We are somewhat more invasive. We do things like colonoscopy and endoscopy. And for a private practice gastroenterologist in the state of New Mexico, the annual premiums are in the high $20,000 range. We're talking about $27,000, $28,000 a year. And there are some surgeons who have premiums that are close to $100,000 a year. And these numbers are much higher than they are particularly in Texas and California. And unless something is done to create some relief in this regard, there are going to be physicians who retire, move, or become staff members of large medical business entities in the state. Right now, only about 20% of physicians in New Mexico are independent, and most of the others are working for large corporate or government structures. And if the private sector is not given some relief in this regard, we'll see that 20% number go down. Many of us feel that a strong private sector is an important balancing aspect of access to care in New Mexico. And as Dr. Whisler pointed out very clearly, it is very, very hard to get a primary care physician in the state of New Mexico. And there are many substantially underrepresented specialties, particularly things like rheumatology, endocrinology, and a number of pediatric specialties. And I just heard from an acquaintance of mine who had to take her child to Denver to see a pediatric rheumatologist because there was none such in New Mexico. New Mexico has a population that is large enough to support sophisticated subspecialties like that. But the environment of practice is such that it is not easy to attract high-quality specialists, and it is even more difficult to attract the number of primary care physicians that we need. So there are a variety of different factors that are involved in this, and we can go into that in some detail. Thanks.
Well, Dr. Gogel, I'm going to put you on the spot again and just ask you, understanding that none of this is set in stone, but if that law, the medical malpractice law, it was HB 75 back in 2021, if that is unchanged, do you have a game plan as to what you and your firm do? Without going into too many details, I don't want to freak anybody out here, but have you thought about it? And if so, any insights into what might happen to you and other doctors like you?
Well, of course we thought about it, and the first aspect of our game plan is to talk to our legislators and other influential people in our community and make sure that they understand the importance of what the issues really are. Our second game plan is to try very hard to identify sources of adequate insurance. it is interesting that at least as of this date, and we're getting very, very close to the legislative session, we have not been able to get a quote from an insurance carrier to cover the potential liability that will exist under an unchanged HB 75. So what we will have to do is either find ourselves in an uninsured position, find ourselves in an underinsured position, or go out to a very broad reinsurance market and see if we can find some reinsurance to cover the difference between what we might be able to purchase in a standard market versus what our liability might be. All of those choices are exceedingly expensive, and we don't even have the numbers right now. So it's troubling.
Yeah. Okay. Well, at least there's some options. That's not much to go on, but it's better than I'm leaving the state, that kind of thing. So, Dr. Whisler, is this something that you'll be in Santa Fe trying to talk to legislators about this session? And there's other issues with regard to the medical profession I want to get to, but when you talk about the shortage, is there already are there already doctors who are just saying, I don't want to even try to practice in New Mexico. They're going down this very dark path, and it's just not a good place for me to set up a practice or to expand a practice, whatever it may be.
I think there are physicians like that. I don't have any data to confirm that, but New Mexico, we are having a very hard time recruiting physicians. There's lots and lots of positions open, and again, the climate needs to change to make it a better place for these physicians to come and work. We're also looking at some issues surrounding loan repayment. Most medical students owe $241,000. Nationally, the average is $241,000. Coming out of medical school, that's huge. We're looking at different ways that maybe we can help with some of that loan repayment and recruit physicians to come here so that they can get their loans paid off.
Fantastic. All right. Well, definitely want to talk to you about that. Before we leave the obstacle, and student loans are something that a lot of doctors and medical professionals have, but let's talk about our favorite topic on this podcast, which is the gross receipts tax, which definitely impacts medical professionals maybe disproportionately to a lot of other folks in the state. So, Sandy, if you want to jump in, and then Dr. Gogel or Dr. Whisler and Dr. Gogel. I've known Sandy for so long, just this for formalities, but to the extent the gross receipts tax is an issue, why don't one of you talk about that?
Well, the gross receipts tax, we are one of two states where it's obligatory that we're charged at 8% gross receipts tax on the income that we have coming into our office. There's only 4 states in the union that require medical offices and all to pay the gross receipts tax. So 8% every 6 months out of what I earn for my practice does end up being a significant amount of money. And so we're trying to work hard to get that repealed.
Okay. And Dr. Gogel, talk about how that applies in practice. I know that under Richardson, the gross receipts tax was no longer applied to insurance payments, but Medicaid providers still have to pay it. It sounds like a mess for doctors and their medical practices to apply the gross receipts tax, even worse than for average businesses, which is saying something.
Well, it's complex, and it requires additional administrative overhead to work out how to pay the tax. And It is therefore quite unfortunate that it is there at all. I would not say that the gross receipts tax is the most important feature of difficulties in attracting physicians to New Mexico, but it is on the list. And the list has 5 or 6 major issues associated with it, and we've talked about some. But when they all add up, it is very difficult to attract qualified, young, and interested physicians to practice here. So, for instance, in our practice, if you look at the doctors who have joined us, they all have pretty deep connections in New Mexico prior to coming to work with or for us. And we don't have anybody in our practice who has basically a priori come out of state with no connections. That's different from the kind of recruiting experience that people in Arizona, Texas, California, and Colorado have. They are able to attract people from the Midwest, from the East, and from the Northwest to come to their locations. And it is the sum total of all of the difficulties that make recruiting difficult. So, for instance, if you go on some of the internet sites that doctors frequently look at, like Medscape, there are frequent displays of data indicating best and worst places to practice. And New Mexico, unfortunately, falls low on the lists that many of us are familiar with: crime, high school graduation, et cetera, et cetera. And one of the lists that we're not so good on as well, which is not as well known, is how are we viewed by medical graduates across the country as a place to come and work? And the answer is not very well at all. We are in the bottom 3 or 4 in almost every instance where this sort of surveying is being done.
Dr. Whisler is, when it comes to other issues in attracting doctors, what other issues stick out to you in terms of why we have this shortage?
Well, one that really stands out to me is our salaries, how much physicians make compared to physicians doing similar work in other states. And overall in New Mexico, we are much lower paid compared to other states. I'm sure Dr. Gogel could go some other places and make quite a bit more than he's making here. I know other physicians and specialties like Dr. Gogel's left UNM and were able to make more money in other places. And when you have a growing family and you're thinking about schools, private schools, regular schools, where to live, good neighborhoods and all, the salary or how much you'll produce from your private practice does come into play.
And just to clarify, obviously doctors are paid a lot differently from a lot of average people that take home paychecks. You've got a lot of government programs to deal with: Medicaid, which is predominantly for the poor; Medicare, predominantly for the elderly. Then you've got, average payers and their insurance companies, cash payments, etc. Just talk about where those different groups come in terms of how much they pay relative to others and how that impacts what doctors are paid in New Mexico. Either one of you, or both of you, hopefully you can both answer it. So Sandy first.
Medicaid does not reimburse extremely well, and at least almost half or a little more of our population in New Mexico is on Medicaid. Filing those claims can be burdensome as well. And then when you have prior authorizations are a huge deal. We have, unfortunately, as Dr. Gogel had mentioned, rheumatology is very limited for children in the state. We're sending a patient up to Colorado. We have to get a prior auth. authorization for that child on Medicaid to go to Colorado. We sit on the phone 30 minutes to an hour with their insurance, their Centennial Medicaid provider, trying to talk to them, and then we have to call Colorado and get MPI numbers and then come back and fill out forms. And the prior authorization process can be totally overwhelming. And I know
And that's because of Medicaid, or that's just
it's
regular
in
occurrence?
general because
Okay.
you have to do it sometimes with commercial as well.
Okay.
And it's very burdensome. And I know rural areas, in Taos, for example, sometimes you have to hire a person just to take care of prior auths and the billing and that sort of thing.
All right. And Dr. Gogel, anything that she didn't cover in that, but also, you make a good point, Dr. Whistler, about the bureaucracy and having to deal with all these forms and hire people to manage all that. Could you talk about that point?
Sure. In our office, we have a dozen gastroenterologists, and we have a whole room filled with people at the staff level that do nothing but deal with prescription approvals, prior authorizations for various treatments and medications. And so it is very expensive. And it is not just private practice institutions that have this difficulty. These same kinds of administrative burdens also increase the overhead of both our public and private larger entities. So this is a big deal all the way around, and it is certainly something that needs to be addressed. One of the administrative burdens that we have not talked about yet, which is important, has to do with credentialing. And if a physician does want to come to New Mexico, they have to get a license, and then only after they get their license can they apply for credentialing with an insurance company. And that can take many weeks. And then after credentialing occurs, they have to be, quote, loaded, unquote, into the insurance company payment program. And only then can they submit a bill which will be accepted and considered for payment. And then insurance companies are allowed 30 plus days to pay the bills. And so from the time that someone wants to come to New Mexico to the time that they actually get an opportunity to provide service and then get paid for that service, we're talking about months. So it's a real problem. And then another very interesting and strange problem has to do with getting medical supplies. Distribution centers for medical supplies are in Arizona and Texas. And so if you want to buy gowns, gloves, syringes, and all those kinds of things that are needed on a daily basis, they have to be purchased from out of state because there's no good distribution centers here. And I'm not saying that there needs to be a distribution center in New Mexico, but what I am saying is since there isn't one, the cost of achieving transport of those materials to New Mexico is higher. And it adds to the overhead of being able to practice medicine in either a public or a private environment. So the combination of credentialing, licensing, costs of malpractice insurance, the low Medicaid payments, the poor incentives for education loan relief, and the gross receipts tax all add up to New Mexico being low on the list of attractive places for medical professionals to come. And actually, it's interesting. It's not just MDs that are affected by this. This is an extremely important point. So there are also disincentives for a variety of other medical professionals to settle in our state. And those medical professionals are people like physical therapists, respiratory therapists, nurses, nurse practitioners, physician's assistants, and many more that I'm not mentioning, but who are critical to the healthcare ecosystem.
All right, Dr. Whistler, you talked earlier about medical loan repayments, student loan repayments, and ways that New Mexico, and I'll preface this by saying that I understand the issue of student loan repayments. Not a fan of the way the Biden administration handled things without so much as a vote of Congress. But if New Mexico's legislature were to put some of that $2.5 billion surplus to work to ameliorate the medical provider shortage, I guess you could come up with worse uses of the money. So that's my kind of framing of the concern here. But is that one of the ways that you could see New Mexico kind of doing something a little more aggressive to bring doctors in? And what other mechanisms are there at policy providers' fingertips?
Well, for the loan repayment, for fiscal year 2023, the legislature did appropriate $1.6 million for healthcare professional loan repayments. There were 600 people who applied for the loan, and they gave 46 awards. The maximum repayment was $25,000 for each year for 2 years, for a maximum of $50,000. Now, states around us have much more liberal loan repayment programs. Arizona, for instance, will pay $25 million or $25,000 every year till the loan's paid off. Texas will pay up to, over 4 years, 190, and I think Colorado over 3 years was 90,000. Texas was 160,000 to be exact. So we are asking the legislature this year to liberalize that to perhaps 50,000 a year for 3 years to pay 150,000, which would cover about half of what the average student owes. There's other things we're looking at is like tax breaks, $5,000 tax break, for instance, if you're a physician and a provider in New Mexico. So people are trying to be creative and look at different ways to incentivize bringing more physicians into the state.
Now, when it comes to patients themselves, what do you hear? And I guess, Dr. Gogel, I'll ask you, in your practice, are you dealing with predominantly people from Bernalillo County, from Sandoval and Bernalillo County, from this region, or are people coming to you for hours and hours? And are wait times an issue in your practice? Just kind of what's the patient challenge of all of this? Because we've talked a lot about doctors and medical professionals.
All of the above for patients. So in our practice, we are now scheduling appointments for routine visits in March of 2023. We are responsive to people who need urgent care, and we have ways of working in people sooner than that who are substantially troubled. But it is not acceptable for someone who calls and wants a routine appointment to have to wait that long. And this has been getting worse as these last several years have transpired. We provide service to many regions in New Mexico, and the telehealth movement has actually helped with that to a certain extent. But the problem is that when we take care of patients who are from rural areas of New Mexico, then people who live in Bernalillo County are further back in line. And it is not just our practice that has this phenomenon. If you look at primary care practices, if you look at other gastroenterology services in some of the large entities in our county, the delays in getting care are even worse than ours. The other thing that happens is that because patients can't get primary care, when we're seeing them in our office for gastrointestinal symptoms and diseases, they're often asking us to help with their high blood pressure, their diabetes, and other issues. And that also interferes with access to the kind of care that we're best at. So patients are constantly telling us that they can't get primary care, they can't get to a specialist that they need, and that they have to wait long periods of time to get appointments that they would like to have. They also point out that they sometimes have to wait long periods of time waiting for prior authorizations from their insurance companies to get the services and drugs that they need. So from a patient's point of view, it's actually more vexing than it is from a healthcare professional's point of view.
Anything to add to that, Dr. Whistler?
Well, I would add on the pediatric side, we do have a limit of subspecialists, for instance, genetics in this state, and that means that a lot of our children, as in the rheumatology example earlier, are going out of state for medical care, which costs the Medicaid system a lot more money for them to go out of state versus them just being seen in their own home town or wherever. So that is a big problem. It's because we just don't have enough specialists to take care of these patients, and that does force them to look for care somewhere.
Right. And well, we're getting towards the end of our show, but I'm going to ask you the biggest question last, and you guys, I'll let you each answer for a few minutes. One part of the question is other challenges. You know, obviously we have crime issues here in Albuquerque, education around the state, and, you know, these are doctors and medical professionals, nurses, et cetera, who are certainly highly educated themselves and are going to want their children to have a good education. So that means probably private school and additional costs of that, or, you know, et cetera. So talk about kind of living standard issues that we all deal with, and maybe talk about telehealth and foreign-born doctors and physicians, and how much of a opportunity that's obviously a national discussion. But I'll let whoever wants to jump on that first. I know it's a big question. Sandy, go ahead.
Well, as far as foreign-born physicians, we are utilizing foreign-born physicians on special visas, especially in rural New Mexico, who come in and help out our physicians. So we are utilizing those physicians from abroad. And then,
but there could be immigration laws changed to enhance or increase that number, and not just physicians, but also nurses and whatnot.
That's true. That's very true. But some physicians who are have been trained and all out of the country, sometimes they're coming back in and they're going to have to do some extra work, such as with the residency program, maybe do 6 months, a year extra, just to get up to par and everything to be able to practice. So that is happening at UNM, and they do a great job with that. And then I'll let Dr. Gogel go.
Well, I think that we're all very keenly aware of the large number of social markers that make New Mexico suboptimal. And we talked about some of them, the rate of alcoholism in our state, the general poverty, food insecurity, all of these kinds of things play into the concerns that all of us have about living and working in New Mexico. Those of us who are here could make more money working somewhere else. We're here because we're New Mexicans and we love this place. And we want to stay here, and we want to see the state succeed. We want to see improvement. And to the extent that folks are coming in from other countries and training other places, Southwest Gastroenterology has such a physician who was trained in a different country, and then additional training in the United States. And that physician is absolutely superior, and we are lucky to have attracted that individual to our state and our practice. The issues regarding Medicare reimbursement and immigration are national issues. We have focused on state issues in this current podcast, but the national scene and things that the U.S. Congress could do also ought to be part of considerations of anybody thinking about how to improve access to medical care anywhere, including in New Mexico.
All right. Well, we're going to pretty much have to wrap it up, but any final thoughts from either of you, if you want to jump in and just wrap things up with one last or two last words of wisdom?
Well, I think we do have a lot of challenges, but we've always had challenges in New Mexico. I think we need to be proactive, and we can certainly overcome those challenges, and we need to make this the best place for people to practice medicine, and also the best place for all of the people of New Mexico to get high quality health care.
All right. Well, thank you, Doctors Whisler and Gogel. I appreciate your time today, and good luck there in Santa Fe. Hopefully we'll be able to work with you side by side to get some of these serious issues addressed in the upcoming 60-day session. Thanks for listening to this week's episode. Find all episodes at tippingpointnm.com or at the Rio Grande Foundation's YouTube channel. Subscribe to this show at Apple, Stitcher, or have your Google Home play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.